The big story that we are following tonight, Rory, researchers are noticing a shift in where COVID-19 cases are increasing during the summer months.
That's right. Well, at the start of the pandemic, the biggest spread we know happened in cities like here in Nashville and Memphis. News Channel 5's Jason Lamb reports the spread is now occurring in more smaller cities and rural areas.
The study shows that while more than half of all Tennessee COVID cases used to come from the cities of Nashville and Memphis, that's no longer the case, with rural areas and smaller cities comprising the lion's share of cases now.
As this disease moves increasingly into these smaller metros, into rural areas, our concern is that there are fewer resources available to the citizens of those areas.
Researchers are looking into why that shift occurred. One possibility, mask mandates in cities like Nashville.
That's one of the areas that we're exploring and doing further study on, but certainly we would suspect that to the degree that populations are able to practice social hygiene, good masking, social distancing, hand hygiene, they're going to do a better job of putting that spread down.
And the researchers say COVID-19 may be having an even greater impact on rural areas than what the data shows, because many rural hospitals in Tennessee have closed down. That means someone who needs a hospital bed from a rural county may end up in a Nashville hospital bed.
What this means is that we need to be taking a look and making sure that there are adequate resources in places that may have fewer healthcare resources in place.
A warning they have for county mayors and other lawmakers in a rural state like Tennessee, where researchers say we could be seeing an even bigger impact in our smaller counties. Jason Lamb, News Channel 5.
Jason, thank you. It is the least amount of COVID-19 cases that we have seen in the past week. The state announced 1,009 new cases today, bringing the state's total to 110,636. 16% of ICU beds are available across the state. 25% is ideal.